Stacy.
Hello, Brittany.
So tell me about your hurt back. Where does it hurt? Why does it hurt? What do you want me to know?
Okay, so it's kind of it's pretty chronic, I would say. I would say it's kind of the same spot most of the time. It radiates down into my legs. It's not so much pain as like a lot of achiness maybe in my legs. The pain and the sharpness is definitely in my back. I would say it's more my low, but right center low. Like if I'm just chilling or like if I'm standing for a long time, it hurts. If I'm like, I like have like a recliner chair I can sit in and it doesn't hurt at all when I do that. Or if I'm laying, it's okay. But if I get up, um, and like if I'm, let's see, if I'm kind of getting up from like this position but standing, kind of
Mhm.
hinging forward and up,
Mhm.
that's when it's like, okay, trying to,
Grabs
I
ya.
get it's really sharp most
And
of
the
the time.
place that it's really sharp is like the right center, right side of center.
Right center, low back. Yeah.
Okay, so we're gonna do a couple tests to see how it feels to do the stretch. So the rules are it should feel easy to do. It should feel anywhere between so easy that you're like, why is this even a thing?
Okay.
To it feels good, kind of intense, but it kind of feels like therapeutic intense.
Okay.
So anywhere in between those. If it feels like it hurts to do, it's hard to do, it's confusing, something like that,
Okay.
then we have to fix it.
Okay.
Okay.
Okay. That sounds good.
It's good that you have like a blank wall to work with because we might use the wall. But for now, is there anything that you can't like sitting like cross-legged? Is this difficult?
Crisscross applesauce.
Yeah, crisscross applesauce or butterfly or sitting on your knees, like sitting on your heels like this. Like, is anything off limits?
I mean, for extended periods of time, this won't like sitting on my tailbone really hurts, but I can do it.
Okay.
Um, Sitting on my knees. I think the thing that like I sort of can't do is like if I'm in bed and I'm laying on my left side trying to get up like
Uh-huh.
from my side. That's where it hurts a lot.
In your back.
So yeah, so like if I'm like this laying on my side
Uh-huh.
and I try to kind of like get up like that, it's like I feel like an old lady.
Yeah. Okay, so what I want you to do is sit in this butterfly pose with the soles of your feet together. And then you're gonna put your hands gently on top of your knees like this. And then you're gonna activate in your low belly. So imagine that you're bringing your pubic bone up towards your belly button and your two hip points in towards your belly button. Get that little activation. And then if you have it, close your knees together and your hands are just giving your knees a little tiny bit of resistance. And then your hands gently push your knees out this way. And you can kind of rock forward as your knees go out, and you can kind of rock backward as your knees go in. But this should either feel super easy to do or feel like a stretch. But what does it feel like?
It feels like a stretch.
Feels like a stretch, and is your stretch right here on the inside of the legs?
No, it's on the outside,
Okay.
of my hip flexors.
Okay, so stop doing that. So the other rule is you should feel the stretch in the right place. So you're straight, you just hook your ankles, and then you just put your ankles down, fold your knees.
Okay.
And then tilt to the side that I think it's your left that you're doing, right? And
Okay.
you're just tilting your knees, you're not twisting your hips. I think that looks good from what I can tell. And then leading with your big toe, it's like your big toe is trying to look over your left shoulder.
Okay.
And do you feel a workout burn on the front of your leg?
Yeah.
And it's kind of in the middle, and so not the middle, it's more in the midline, right? The lines up with your big toe.
Yeah.
Okay. And then when you're ready, switch sides. But do as many as you think feels good.
Okay. So
And then
switching
switch
sides.
ankles and then just roll to the other side. Your knees just tilt.
And I want my knees toward my face, right?
Yeah, keep your knees as close to your feet as possible with the help of your belly, the strength in your belly. You're tilting over to the right only as much as you need to. You don't need to have a big tilt. Just a slight one is fine. Adjust as needed. And you're leading with your big toe. Your big toe is trying to look.
Yeah, on that side it's really sharp.
Ooh, okay.
Really sharp. It's not sharp when I'm down,
Uh-huh.
but when I bring them up,
Yeah.
It's like owie, owie, owie.
It's like owie, owie. And it's in the back. It hurts in the back.
Yeah.
Okay.
It's right. Let me show you. Right here.
Okay. All right.
Okay.
And we're gonna do splits in the air. So what that looks like, you're gonna be on your back still. You're gonna tuck your knees in, and then you're going to straighten your knees, trying to keep your legs as close to your face as you can comfortably manage.
Okay.
And then you're gonna put your hands, palms, so knuckles together, palms facing out. You're gonna put your hands between your knees.
Okay.
Then activating that belly really tough, really get all your tension in that belly, and then press the knees apart into the splits or the straddles. And then bring it back together. Okay, how'd that one go?
Good. No
Good.
hurting.
Easy?
Yeah.
Good. Now, whichever the hamstring you want to stretch, just put your fingers behind your hamstring like that. Your other foot can be on the floor where it feels like it's supporting your lower back. You're gonna pull your leg towards you. Your belly does not have to be activated. Rest your belly. Your belly is really soft. Pull your leg towards your face as much as you want, and then rotate your ankle. Get a little ankle stretch. And then push that hamstring into your hands, and your hands are not going to let it go. So your hamstring will eventually start picking you up off the floor, and you're getting kind of a shoulder stretch here. And it's like your hamstring wants to go down, but your hands won't let it. And then pull with your shoulder blades and your elbows to bring your knee back towards your face. You can lay your head down. And then back again. Really making sure that your belly and your pubic bone and your hip crease is soft. Think of your sit bone as like pulling downward towards the floor. And that's what's gonna pull you up. Yeah. And then pull it back again. And then get a foot roll. And this should just feel like hamstrings, calves. Everything feel good?
Good. Yeah, that feels good.
And then switch. So the side that you want to try first, lengthen that leg out so it's laying down on the floor. Here, I'll switch.
Okay.
And then you're going to hold the other knee like that.
Okay.
Okay. Now activate your belly. Hip points pull together. Pubic bone pulls up towards your belly button. And then I want you to straighten your knee and kind of lock your knee, but don't hyperextend your knee. And then maybe point your toe just a little bit, and maybe roll your knee and big toe inward just a touch. And then lift your leg.
Okay.
Yeah.
Well, that's nice.
Does that feel nice?
Yeah, it does.
Good. You kind of like a little massage on the back, a little workout in the belly. And then when your leg lowers to the floor, it doesn't have to touch the floor. Maybe just the heel barely kisses the floor. And just go back and forth. And then switch legs when you're ready. Your butt up against the baseboard and the side of your leg up against the baseboard. Okay. And now start to turn your body around, but try to keep your butt at the baseboard the whole time. And just kind of keep, it's not easy to do, but just try to get as close as you can.
Okay.
And then put both legs up the wall. Yeah, and you can kind of walk one butt cheek at a time towards the wall if you use your elbows to help. How you feel?
Feels good.
Doesn't this feel so good just doing this?
Yeah, it really does.
So just put your right foot in front of your left leg and just slide your foot down your shin until it finds your knee where it wants to be. And then bend your knee so the leg that's long up the wall, just bend your knee towards your face, put your hands on the floor, and then you can lift your butt up off the floor as you go down. And then slide that leg back up.
Oh,
And then slide it back down again.
that's nice.
Isn't that beautiful? But don't stay in that position. Go back and forth. That's
like
the point. You gotta, your foot that's in that bent figure 4, that's gonna push your knee back to the wall. And then your knee is gonna push your foot towards your face. Back and forth.
Really nice.
And then switch when you're ready. Okay, so do as many as you want on each side. And then when you're ready, just roll back to where we were. And now we're going to retest the quad one that was buggy before.
Pinchy.
Yep,
Okay.
so you're gonna lie down and put one ankle on top and put the ankle on bottom that hurt last time, the one that didn't work.
Okay, so
You're
my
gonna
left
roll
leg
your
is
body to the
left
same
ankle
side
bottom.
shoulder
Okay, yes.
of the foot that's on the bottom. And then you're going to lead with the big toe. And your big toe is going to try to look over its same side shoulder. How does it feel now?
It's not as pinchy.
Yay! Does it feel good?
It does, it feels good.
Good. Yeah, test it out and see what it feels like now. You're getting out of bed.
It didn't hurt.
Yay!
That's usually the most. Let me try again. The most hurty side. Okay, that's good, that's good. Let me just double check, because it might be this side, but I think it's the other.
Okay.
Okay, I'm sleeping.
Now I'm getting out of bed.
It didn't hurt.
Yay! Congratulations. Okay, so I recorded this for you, so if you want to use it again,